Good day everyone, I am Lloyd Tabor from BSN1-D, and for this video, I will be going over the nursing assessment of the cranial nerve 1 to 12. Cranial nerves 1 to 12. First thing we should do is to provide privacy to the patient, perform hand hygiene, and explain what we have to do or the thing we're doing. So first, we have to test the olfactory or the cranial nerve 1, the sense of smell. So I want you to do, ma'am, is to close your eyes, and I'm gonna put something in the front of your nose, and you're gonna tell me what you would smell.
Pandan flavor.
And this was a pandan flavor, and that's correct. So it means that the cranial nerve 1 is intact. Second, to test the cranial nerve 2 or the optic nerve, we're doing two tests. First, we're gonna be looking at the confrontation visual field, and we're gonna be looking at the peripheral vision. Next, we should be looking at the visual acuity using Snellen chart to assess that. First, we're going to test the peripheral vision by doing the confrontation visual field test, and to do that, my patient will stand in front of me. So ma'am, stand in front of me and about arm's length away. And I want you to cover up the right side of your eye, and I would also cover up the left side of my eye so that we could have a opposite side. And I want you to watch only or focus only in my eyes, and don't look in my finger. And I want you to state how many fingers I will create. So I will put my finger in the upper visual field, in the lower visual field, in the middle visual field. So here we go.
2, 3.
Okay, in the opposite side. So remember, don't look in my fingers.
2, 5.
Okay. Next, we're going to test the visual acuity using the Snellen chart. So my patient will stand 20 feet away from the chart, and I would like to ask her if she wants to wear an eyeglass.
No.
No. So she didn't want to wear an eyeglass. So ma'am, I want you to read the lowest line in the chart that you can read, and we're gonna do it by first covering up your right side of your eye. Next is the left side of your eye, and you're gonna read it with both of your eyes. So first is the right side of your eyes, ma'am. Read the lowest line that you can read. What number?
Line 8.
Line 8. Can you please read what's in the right and line 8, ma'am?
D, E, F, P, O, P, E, C.
Okay. Let's proceed to the left side. Can you please again read, ma'am, what the lowest line you can read?
Line 8. D, E, F, P, O, P, E, C.
Okay. So you read it in both of your eyes. What number what line do you see?
Line
Yes.
8.
Line 8 again. So
D.
can you please read me?
E, F, P, O, P, E, C.
So that means that the patient has 20/20 vision. Next we have to do is we're going to assess the patient's cranial nerve 3, which is the oculomotor, cranial nerve 4, which is the trochlear, and cranial nerve 6, which is the abducens. And we're going to run several tests to check the functions. So the first one that we're gonna do is we're gonna be looking for any involuntary shaking of the eye called nystagmus. So I have here a pen light, and I would hold on about 12 to 14 inches away from the nose of the patient. And Hannah, I want you to do is keep your head still. Don't move your head, and watch only on the pen where I'm going to move. So I will perform the 6 cardinal field of gaze and look for any involuntary shaking of the eyes. So let's start. Next, we have to see how reactive the patient's pupil are to lie and to do that. So we're going to dim the light a little bit, and we're gonna have the patient stare off at the distant object that helps dilate those pupils. Object. Then we're going to shine the patient's pupil using our pen light, and at the side, we're gonna see how the pupil respond if it constrict, and on the other side if it is constrict as well. So ma'am, please stare that object on the wall or any distant object to check the dilation of your pupil. So we're gonna shine. So next we're gonna do is we're gonna check for accommodation, and how we do that is turn the lights back on. So we're gonna turn the lights back on. We're gonna have the patient stare off at the distant object, and that helps to dilate the patient's pupil. So I'm gonna use a pen light finger, and I will slowly move inward to the nose. What we're looking for is that those pupils constrict, they accommodate, and the eyes cross while looking at the pen light. So, ma'am, I want you to stare off the distance, and I'm going to and I want you to do not move your head or anything that cause the head to move. Just you just need to keep it still. So here we go. So we have done that procedure. So now we proceed, because we just check all the things with the eyes, and we can say that the pupils are equal, round, reactive to light, and accommodate. That's where the perla comes into play. So now we're gonna go ahead to and test cranial nerve 5, which is the trigeminal nerve. So I would ask the patient to clench his or her teeth, like bite down. So ma'am, and then I'm gonna feel her masseter muscle, and also her temporal muscle. And now I would also test the nerve that have her try to open her mouth against resistance. Can you do it to me, ma'am? And there you go, she can do it. Now we're gonna go ahead and look at the facial expressions and test cranial nerve 7, which is the facial nerve. So ma'am, I want you to close your eyes tightly and afterwards open it. And ma'am, can you please smile, frown, and put out your cheeks. And the patient do it with is, that means that the cranial nerve is intact. So next we're gonna test cranial nerve 8, which is the vestibulocochlear nerve. So what I'm going to do is I'm gonna include the patient's ear or one of the ears, and then I have to whisper 2 words on the other side, and Hannah, you will tell me what you have, what I have said. So, are you ready? Here we go.
Apple, pineapple.
Okay, and the other side.
Banana.
So that's correct. That means that the cranial nerve is intact. So now we're going to assess cranial nerve 9, which is glossopharyngeal. And I would request you, ma'am, to say ah. And what you want is that what I want is the uvula to move up, and the patient can do it. And the cranial nerve number 10 is the this means that the patient is able to do that. So the vagus nerve is intact because the patient is able to talk without harness, and she's able to swallow. So what we're going to do is we're going to test the cranial nerve 11, which is the accessory nerve. So what you can do, ma'am, is to move your head side by side, up and down, and then I'm gonna jog your shoulder against resistance. And my patient was able to do that procedure. That means that the nerve is intact. Next, we're going to assess cranial nerve 12, which is the hypoglossal nerve. Ma'am, I want you to put out your tongue and move it side by side. And my patient do it. So that means that the cranial nerve is intact. So that's it. That's wrap up how to perform the nursing assessment of the cranial nerve.